about technical difficulties there. We all know that the internet and technology can be a little testy, so if that happens, bear with us. I promise we will pick right back up where we left off. Because I don't know exactly where we got cut off, I'm going to back up just a little bit. Never hurts to hear things twice. So, as I was saying, while we're assessing Allie's abdomen, I'm identifying those peaks and those borders. So we've already gone in and we have identified the border of her abdomen. I've now gone in twice with this applicator template and identified a treatment in her lower abdomen. So that's going to be treating that pocket right there with a very heavy overlap right in there to treat this dense pocket of fat in the middle. Next, I have gone in and I want to do a really significant overlap to accent that small of her waist vertically as well. What that allows me to do is not only get a double treatment right here in that dense pocket, but I also get to get a double treatment right here on the outside. So really, we're just kind of getting that nice 2-in-1, seeing some really pretty rapid results with that as well. So again, like I mentioned before, unless I got cut off by the internet, this, every time I place it to Allie's body, is considered a treatment. So far, we've gone in and we've positioned 1 treatment, 2, a vertical 3, and 1 more vertical 4. Now, one of the biggest things that you always want to remember with CoolSculpting is that we have to treat to complete. We never want to solely treat the lower abdomen or the upper abdomen unless it is a very, very specific circumstance. That reason being, the majority of the population is going to carry a uniform pocket of fat throughout the areas we're looking to treat. And I'll show you visually. Allie, if you'll turn to the side towards that table for me. If I were to go in and only treat this area right here, you start to see this stick up, and that's what we call a shelf. So often a lot of people will ask, well, can I not just treat this area and see how I do? And again, in CoolSculpting, we always want to treat to complete and treat that full picture. So if I'm taking a look at where that pocket of fat defines itself, it's from that lower abdomen right up to that upper/mid abdomen. So up here, if I stop at this treatment, really not ending up with a shelf because there's really no subcutaneous tissue for me to treat. So that being said, I'm going to go in and I'm just going to finish out that assessment with Allie. So that final area that I'm going to look at is how her tissue orients here. Now, one thing that we do know is the abdomen often orients itself in a natural diamond pattern. So it has a little bit of that right here and then kind of bulking down towards the bottom. So I want to follow the orientation of that tissue by identifying how it falls into the small of the waist. Because remember, we are always wanting to accent that really pretty natural shape. So I'm going to go in here and again, identify where that peak lies. Okay. Pull that tissue, and then I'm going to go in here and figure out where it starts to taper off. And it may look like I'm pinching her hard, but I can assure you I'm not. Okay, so we're going to go here and mark that taper line. I'm going to continue to feel where she tapers. We're going to go right up through here. So once again, I want to situate that densest area over the middle of my applicator, situate right in here, and we are going to sculpt right along here. Beautiful. So now you can see we have covered full tissue from top to bottom. So we're just going to do the same thing on the other side. Now again, Allie doesn't necessarily have much asymmetry from one side to the other, but say if she did, it's absolutely possible that I would look at treating. Maybe there's an asymmetrical pocket of fat here and here that doesn't present itself on the other side. Absolutely, I'm going to go in and I'm going to treat the way the tissue orients itself. So if that was the case, I would treat over those necessary pockets of fat. CoolSculpting truly is an incredibly customizable treatment to your body. Okay. Okay, now at this point, this is the point where you take a look down at your abdomen and say, it looks like my 3-year-old got a hold of some markers. It's totally understandable. Just trust the process and trust that I do in fact know what I'm looking at here. So now that we're completely marked up, we're ready to treat. So Allie, if you'll go ahead and just grab that chair. Make sure that we're nice and prepared here with all of our supplies. And as you can see, we've pretty much got everything set up to the way we need it to be for the area that we are treating today. So first thing that I'm going to want to do is make sure that my system is set and ready to go, and then we're going to actually prep the tissue and make sure that she is fully protected and taking the proper steps to ensure that there are no adverse reactions. First thing I'm going to do here is do a full 60-second pre-treatment skin wipe to each treated area. This ensures that that skin doesn't have any excess oils, lotions, or anything that could inhibit that tissue or the surface of your skin from cooling to the exact temperature that we want. So we're going to go ahead and start that now. Again, this may feel like quite some time to go in and clean this area, but this is an incredibly important step in the process, as it ensures we not only get excellent and even results, but it also ensures that we won't have any complications during the treatment. Again, I know what you're thinking. How is she going to know where to go when she just wiped off all of those markings that she made? Trust me, I've got a process. Beautiful. Now, something that I'm really thrilled that we have here at Brooke Nix Medical Aesthetics is the CoolSculpting Elite. The CoolSculpting Elite is the newest CoolSculpting machine on the market. It actually allows us to do dual sculpting, whereas previously we were only able to treat one treatment area at a time. So essentially we would do each of these one at a time. Each treatment that we're doing on Allie today is 35 minutes. So anytime you're coming in for a CoolSculpting session, you need to plan to be in office with me for a couple of hours. No fret, we have Netflix, we get you snacks, lunch, and make you as comfortable as possible. However, having the CoolSculpting Elite really allows us to cut down on that treatment time and treat 2 areas at once, which is what we're going to do today. So I'm going to go in here and we are going to clean that area that I am dual sculpting as well. Make sure all that oil, any body lotion or anything of that nature is off. Often, if I have somebody coming in for CoolSculpting, I will ask them to refrain from putting on any kind of perfumes, lotions, anything of that nature, just to be extra, extra safe and make sure that that treatment goes as smoothly as possible. Beautiful. Okay, so the next step in the process, and what I deem is potentially the worst, is putting on the protective gel pad. This is a, no better way to say it, but pretty sticky and gooey gel pad that is going to lay over the area that we're treating so that when that vacuum applicator goes on and suctions up that tissue, we're not causing any harm to the actual skin or the surface that we're treating as well. So we're going to go ahead and start that process now. Okay, folks. So this is going to be that protective gel pad. Now, like I said, these gel pads are incredibly gooey, so we do have a shower here in office at Brooke Nix Medical Aesthetics, because we know if you've been here with me for roughly 3 to 4 hours, you've been gelled up all day, you're probably not going to want to go and roam out and about feeling really, really sticky. So not only will I make sure that she's nice and clean after the treatment is complete, but I also have the option for her to hop in that shower and just really make sure that any of that gel that's clearly dripping everywhere and on her legs as well at this point is nice and cleaned up for her. And we're gonna go ahead in and place one more at that second treatment area. Now, I do have disposable CoolSculpting garments that we keep in office. Allie is wearing the CoolSculpting briefs. We do like to have uniform garments, so that way our before and afters stay really nice and well uniform. But Allie specifically opted in today to wear one of her old black sports bras. I have no qualms with that, no issues, as long as we make sure that we're keeping consistent garments each time. But we will make sure that if you don't have any old garments that are that solid black color that you're hoping to wear, that you are covered on our end with all of those CoolSculpting official garments as well. We're gonna go ahead and clean up along the way here. Okay, so now you've heard me talk about a whole lot. It's time for you to actually see what it looks like to start that treatment. How you feeling, Allie?
Good.
Good. Okay, so we're gonna walk through this setup process here. And all I'm doing is just identifying the treatment areas that we're gonna treat. When we get to this, you can see that at this point, it is telling us that Allie's treatment time today is gonna be 35 minutes on this first round at negative 11 degrees Celsius. So I like to tell people, and we'll get into this a little later as well, that whenever we start that CoolSculpting, that first 5 minutes is gonna feel like you've gone outside and stuck your barefoot in the snow. Negative 11 degrees Celsius is pretty cold. So I like to hang tight, make sure that everything's going okay, that Allie's feeling all right once we get that treatment started. But after about 5 minutes, that area is gonna go numb. Okay. And we're gonna go ahead and get this set to where we need it to be. Okay. First thing I'm going to do here is identify this little mark that I've got to make sure that it lines up with my seam. This ensures that because when she sits down, the orientation of her tissue changes. It ensures that I am keeping exactly the treatment area that I want. Okay. Allie, does that feel like it's got a nice tight suction? Perfect. So what you're going to feel at this point is just a little bit of that tugging of that tissue being pulled into that suction. Shouldn't be uncomfortable, painful, would you agree?
Yeah.
Okay? Not uncomfortable, not painful in any sorts, just feels a little but again, no pain whenever we get that vacuum applicator placed on. So first thing I'm going to do is go ahead and start strapping here. Now, thing proper, and that really sticks to that orientation marked. So I'm going to employ Allie's help here. If you'll just keep that hand right there, just don't press in too hard for me, okay? If you'll just let that loose slightly for me, Allie. Beautiful, and just stay right there. And again, I'm going to take a look at that orientation mark of where I want to treat. Line it right up on that seam. And we're going to go and pull that tissue. And how does that feel?
Good.
Great. So the next thing that we want to do here is make sure that Allie is strapped in nice and tight. With CoolSculpting, one of the biggest things is that we not only get her strapped in nice and tight, but that I ensure she's as comfortable as possible. Because once that treatment starts, we really can't move for fear of getting a pop off is what we call it, or essentially where the applicator comes loose and we have to, of course, not what we want. So we're going to make sure before we actually start that treatment that Allie is nice and comfortable. Okay. So when I see here, I can go in. Notice that I have a little bit of slack here, which is of course not what we are looking for. So I'm just going to readjust slightly. Allie, hang tight with me. Okay, here we go. Perfect, so that looks much tighter. I'm gonna go in here and we're just gonna do the same thing again. Okay, and Allie, you can let go of that applicator. Thank you, ma'am. Okay. Now when I let those applicators go, they face, which means you've got an excellent strap. Allie, is there anything that is uncomfortable for you? Okay, excellent. So I'm going to make sure my patient, so I'm going to grab you a little blanket just to cover you up. That feel okay? Perfect. I'm just essentially now going to go in and start that treatment. So while that starts to get really nice and cold for us, check in on her here in about 3 to 5 minutes, see how she's doing, and of course she'll let us know if anything's feeling uncomfortable. Like I said, what to expect with CoolSculpting? Well, this first session for essentially first 5 minutes, she's like she's gone outside and stuck her bare foot in the snow. It's going to be almost so cold that you feel or a little. That sensation really only lasts for about 5, maybe 8 minutes. Essentially after that 8 minutes, that area is going to go numb. At that point, most people really want to just lay back, watch some Netflix, and kind of chill. So with CoolSculpting, I like to go into why CoolSculpting. Let me give you a little bit of a background on what CoolSculpting is, the technology behind it, and why we are so in love with it here at Brooke Nix Medical Aesthetics. So CoolSculpting uses a technology called cryolipolysis. Cryolipolysis is essentially a very fancy way to say fat cell death. We have found over 20 years of research and development that fat cells cannot survive at a certain temperature. To give you a little bit of the backstory there was a scientist who had a hypothesis that fat cells couldn't survive at a certain temperature. He looked into a case study where a child had fallen asleep with a popsicle in their mouth. Later went to the hospital with some divots in their cheeks from where those fat cells had frozen, died, and essentially dissipated through their lymphatic system. Well, of course, we don't want to end up with random divoting, so again, over the last 20 years of research and development, CoolSculpting was born. The way that we do that, and what we're doing with Allie here today, is we're identifying those pockets of fat, that tissue, putting that applicator over that area, and exposing that full tissue to that negative 11 degrees Celsius to cause some controlled inflammation or inflammation of those fat cells, causing them to die, and then over the course of 30 to 90 days, they dissipate through your lymphatic system. One of the most common questions I get with CoolSculpting is, well, how long does it last? Is it permanent? The short answer is yes, it is permanent. Now, that doesn't mean that you can go haywire and eat whatever you want. We always say with any kind of fat reduction, whether it's surgical or non-surgical, that it is so important to always pair it with a healthy lifestyle. So let me kind of paint a picture of what that will look for you. Once we reach maturity, we only have a certain number of fat cells in our body. The only time our body produces new fat cells is when we reach morbid obesity, and our body cannot support the fat cells that we have with just the number that we have. However, when we are still with that level number of fat cells we have from the time that we're born, we are able to freeze those fat cells, dissipate them through that lymphatic system, and they're gone for good. Now, that doesn't mean that other fat cells can't still grow or shrink when you gain or lose weight. What it does mean is that those fat cells that we've treated in Allie's abdomen are not going to come back. It also means that if Allie were to gain weight again, she would be less likely to gain it in her abdomen because we've removed roughly around 25 to 50% of those fat cells, depending on the number of treatment sessions. Now, with CoolSculpting, I like to talk about why CoolSculpting versus surgery. Everybody is completely different, and this is something I really like to go through in my consultations as to why you've chosen CoolSculpting versus potentially something like liposuction. Now, there are many, many benefits to surgery, and there are many, many benefits to CoolSculpting. The number one thing that I like to tell people is you always want to remember with CoolSculpting that they are not overnight results. So that is something that's going to be different than a surgical approach. However, CoolSculpting has little to absolutely no downtime, which is why many, many people choose CoolSculpting. It is incredible for people with busy lifestyles, people who have children and really don't have the opportunity to take time off of work, to have downtime, or even for people who are not a surgical candidate and really still want that fat reduction. It's a great non-invasive approach. Now, that being said, I want to tell you a little bit about the process and how many it takes. So with CoolSculpting, a full treatment of CoolSculpting is considered 2 full treatment sessions. So Allie will be in here today receiving 6 treatments to her abdomen, but her session today is considered 1 full treatment session. In order to achieve Allie's goals and those results that we're looking for, she will need to come in and see me for 1 more full treatment session to her full abdomen. That reason being because every time we place that applicator, we get a 25% reduction. And in order to really get the CoolSculpting results that we want and that people expect or need, we are needing to get a full 50% or more reduction. So the number of treatment sessions you will come in an office with me will be very dependent on each individual body type. I want to take a second now to just go through a couple before and afters with you to walk you through the process of what some in-office procedures has looked like for each of our patients, and also talk to you about the expected cost for some of those treatments. So we're going to pan over to that now. Okay, so this is an excellent before and after with a patient who was very, very happy. So this patient allowed us to really go in and sculpt out that pocket of that was stubborn and he felt like was creating a fuller look to his abdomen in general. We did 3 sessions to the lower abdomen, and I'd like to talk to you about why we did 3 sessions. That first session we chose to initially debulk his abdomen, which means we went in there and just really tried to pull as much of that tissue and devolumize the area. That second session, I was able to go in and sculpt a little more along that natural V that he already has, but just to enhance it and smooth out that shadowing. And then that third session for him specifically really just drove home and allowed us to really accent that natural V shape and accent his natural athletic shape. This patient was an excellent candidate to do Cool Tone, finishing up after his CoolSculpting. So Cool Tone is a magnetic muscle stimulation device that creates involuntary contractions of the abdomen, glutes, hamstrings, or quads. We did 8 sessions of Cool Tone to his full abdomen to really not only go in there and strengthen his core, but really, really define those muscles to drive those CoolSculpting results home. This patient was beyond happy with his results, as was I, and this full treatment plan ended up costing him right around $4,200. We're going to take a look at the next patient here. Okay, so this next patient was someone who came to me and just stated that she really wanted to debulk her abdomen and flanks and also just feel like she was fitting in her clothes a little bit better. I was very, very pleased with these results. This patient's tissue responded beautifully to sculpting, but as you can see, it sounds like magic when I talk about the fact that I can place an applicator to you and that I can freeze those fat cells and they just disappear permanently. Let me assure you folks, it's not magic, it is science, and it actually really does work, as you can see here. So what we did with this patient is it was 2 full sessions of CoolSculpting to her full abdomen. That is going to be the full lower abdomen all the way up to her high upper abdomen by that rib cage. We also went in, and because this patient carried a little fuller all the way out and around the backside of her flanks, we decided to give her the absolute best results to treat her flanks as well. Because as you can see, going in and not only also treating those flanks has allowed us to carve out a really pretty natural hourglass shape and create a little bit of a divot in the small of her waist, which we were both very pleased with. With that first session of CoolSculpting, we focused mainly on devolumizing the area, and then it allowed us to go in and sculpt further to accent her waist in that natural hourglass shape with her second. Again, this is a really key component and a key indication as to why 2 full treatment sessions of CoolSculpting is so important. I have many patients who will come in and maybe feel slightly discouraged after that first session. And I always want to remind you that a 25% reduction, while it still is incredible and it's a significant thing, is not going to get those driven home results that we're really looking for, which is why 1 full treatment of CoolSculpting is always split up into 2 sessions with me in office. This patient ended up paying right around $7,700 for 2 full treatments or treatment sessions to her full abdomen and to those flanks. And then the last one I want to take a look at here . And we're back. Okay, so the last one I want to take a look at here is a really, really beautiful flank transformation. So this patient is an incredibly athletic patient, is very, very consistent with diet, exercise, but as we all know, it feels like you can do everything under the sun and stubborn pockets of fat will still persist. So this is a perfect instance for CoolSculpting. As you can see in that before photo, we've got a little bit of fullness that sits over the top of his pants right around the flanks. Essentially, what we're wanting to do here is really go in and grab what sits right on top of his pants, but if you'll take a look right on the left flank there, you'll see a really harsh line where he carries a little bit of asymmetry. And that's what I was talking about when we were looking at Allie's abdomen. The natural asymmetry is totally normal, but we want to make sure that we're treating correctly. So for this patient, we treated a little heavier on that left side to make sure that we were accommodating for that asymmetry and achieving as symmetrical results as possible, which I think that you may agree that we really achieved some beautiful asymmetry on these flanks. This patient ended up for 3 full treatment sessions to his upper and lower flanks, ended up paying right around $4,800. This is an incredible patient who was so pleased with these results that he wanted to go in and actually start some Cool Tone to his abdomen just to drive home some results and help increase muscle strength right in that area to make him feel just as good about his abdomen as he does about his flanks. Okay. So the next thing that I want to do here is just go through a couple frequently asked questions that I hear almost every day from patients potentially interested or getting CoolSculpting here in office. First thing that I want to touch on, which we've already touched on a little bit, is what does CoolSculpting feel like? Well, like I said, CoolSculpting in that first 5 minutes, 5 to 10 minutes, is going to feel like you've gone outside and stuck your bare foot in the snow. If you're just now joining us, this is the 3rd time I've said this, but I really like to drive it home because the last thing I ever want to do is a patient come in here and not feel like they're properly prepared for that first 5 minutes. Because in reality, it's not all that fun to feel like you've stuck your bare foot in the snow for about 10 minutes. However, once we've gotten through that 10 minutes, that area is going to go numb and you really are fairly comfortable. I think this is a pretty good time just to go in and check on Miss Allie here. How you doing over there, Allie? Good. Would you?
Definitely numb now.
Okay. Would you agree that that first 5 minutes feels like it's kind of gone outside, stuck that barefoot in the snow, little bit of burning, little bit of stinging?
Definitely. Just slightly uncomfortable, but
Okay. So if you didn't hear that, Allie said it was just slightly uncomfortable, but certainly not unbearable. And Allie, if you had to rate that on a scale from 1 to 10, where do you feel like that would sit?
maybe a 4.
Okay, so for Allie, she said she feels like it sits right around a 4. I've had patients who say that they feel like it sits around a 2. I'm not gonna lie, I'm a little bit of a wimp, and for me it sits right around a 6. But I've done multiple sessions, and it's something that I would never, or that would never keep me from continuing CoolSculpting. Again, I normally tell people it'll be uncomfortable, but we can get through it because it only lasts about 5 minutes. Now, something that I do like to tell people whenever we get to the question of what it feels like is truly what I consider and what many consider the most uncomfortable part of the treatment. And that's going to be the 2-minute post massage. So if we take a look at Allie's time here, she's about 15 minutes into her treatment. Once she finishes out the remaining 20 minutes, we're going to pop those applicators off and I'm going to do a 2-minute post massage to that area. It really shouldn't be called a massage because it's not very fun, but it's absolutely necessary. What we're doing when we do this massage is really going in there and breaking up all those fat cells, kick-starting that inflammation so that they can start to die off and dissipate naturally through that lymphatic system. This is something that I really like to coach patients through because it is uncomfortable for about 2 minutes. However, if we don't do that 2-minute post massage, that treatment is 68% less effective, which is crazy and almost, in my opinion, a waste of money if we don't do it. 68% is a huge number, and so again, I tell people you can kick, you can punch me if you need to, but we're gonna get through it together. That 2-minute massage is certainly uncomfortable, but it's definitely bearable. It's certainly something that I've never had anybody say they can't come back and tolerate again. We're gonna go on to the next question here, which is how long does it take to see results? This is essentially to give you a broad answer. You can expect results as early as 1 month, but those fat cells are continuing to die for up to 3 months. So to give you insight into what Allie's process is gonna look like, we'll do a full treatment today, and then she will come back in and see me in about 6 to 8 weeks. That's because I really wanna get the majority of those fat cells to die off and dissipate through that lymphatic system before I go in there and I treat her again so we can get all those fresh fat cells that are untreated. After that, she's gonna come back in about 8 weeks. We're gonna take a look and determine if we've driven that home at 2 treatment sessions, or maybe we potentially need to add on a 3rd. If not, then right around that 8-week to 3-month mark, I wanna take those after photos for Allie, and she should be seeing that excellent result at that point. Now, that being said, you absolutely will start noticing results much sooner than that 3-month mark. For me specifically, when I treated my abdomen, it was almost right at about a month when I went to go put on some jeans and they just felt like they fit a little bit looser, which is something that I'll hear from patients very frequently and something that's really encouraging along the way as well. The next question that we're gonna take a look at here is what is the downtime? And this is something that I hit on when we were talking about CoolSculpting versus surgical intervention. So CoolSculpting has virtually no downtime. It can have little to no downtime, and when we say little downtime, I like to tell people, here are some of the things that you can expect post-CoolSculpting. CoolSculpting is likely going to cause what we say an impaired skin sensation, which essentially means that area is going to be numb for up to anywhere from 2 to 4, maybe a little longer, weeks. For me personally, my numbness normally lasts right around 4 weeks, which I tell patients to expect. If it doesn't end up lasting 4 weeks, we can be pleasantly surprised, but really and truly, you don't even quite know that numbness until you hop in the shower, go to wash your body, and you say, oh, I can't really even feel my abdomen. Outside of that, we can also get something that's a little more rare, but does happen, called late onset pain. This is really a very, very tolerable side effect, but essentially we'll feel like some slight twinges, in Allie's case, potentially in the abdomen where we've treated, or might feel like some slight cramping. I normally tell patients some anti-inflammatories or like an ibuprofen, a Tylenol is perfectly okay to take and will usually help dissipate those symptoms very quickly. Most of my patients say if they get any little bits of cramping, it happens about a week after treatment and normally only lasts a day or two and is very, very tolerable. As far as downtime or what you can and can't do when you leave treatment, I always tell people you might be a little bit tender, so when you go home or if you want to go work out, if your kids are pulling on you or if you are working out, anything of that nature, it might feel a little uncomfortable to have clothes rubbing on it or to have kids pulling at you, but it certainly is not going to be something that's unbearable. For me personally, after my CoolSculpting, I went straight to the gym and worked out. I had no issues, and that's what most patients voice and say, that it really is not anything that keeps them from resuming their normal activities. So when Allie leaves here today, I'll let her know that she can resume her daily activities with really no issues. The next question is going to be, why CoolSculpting instead of surgery? Well, we've kind of already gone over this, but just to drive that point home, I like to let everybody know that we will assess you in office with that complimentary consultation and truly determine if you are a better candidate for CoolSculpting or if it might look like surgical intervention is a better route to go. CoolSculpting is an excellent treatment option and yields beautiful results. But one thing that we always want to identify in office is your treatment goals. So with CoolSculpting, we are absolutely able to meet so many treatment goals with minimal to little to no downtime and really have a beautiful result without having any downtime, anesthesia, anything of that nature. And then the last one that we've got here for frequently asked questions is, how much does it cost? So I wanted to really go into detail with each of those before and afters to give you a little bit of insight into cost per scenario. And as you could see with each of those treatments and each of the patients, cost was pretty vastly different. And that's because every body is completely different. So when it comes to cost, I always like to let people know, please come in and do a consultation. This is going to be the absolute best way for me to take a look at your tissue, determine your goals, and figure out what is going to be the best treatment option to reach those goals. Because everybody and every is completely different, cost is going to vary from person to person. However, something that I am beyond thrilled to talk about today is because you have tuned in to this live CoolSculpting event, we do have fantastic savings on our CoolSculpting packages. So anybody receiving a minimum of 6 to 8 treatments, so like Allie here today, she will be receiving 6 treatments for another 6, filling her package up to a treatment package of 12 in-office treatments. That means Allie would qualify for our treatment package pricing of 30% off those 12 treatments. This is an excellent saving and one of the will do year-round. Not only that, but we have a fantastic reward program called Allie that we are able to give you more every day ways you can get dollars in savings through Allie. If you're interested in CoolSculpting, you have 865-333-0186. Thank you so much for tuning in with us today, and I can't wait for a complimentary CoolSculpting consultation.